Hey everyone, and welcome back to the channel. If you're new here, my name is Leher and I'm a clinical academic doctor working in the UK. Today's video is all about navigating a communication skills station on explaining a new diagnosis. This is useful for anyone sitting medical school or postgraduate exams. In this video, I'll be discussing how you can structure this scenario to help you secure those top marks. I also have some videos on other communication skills scenario if you're interested, and I'll leave the links to these down below. This is a very common scenario in medical school and postgraduate exams like PACES. I'll be using multiple sclerosis as an example to help illustrate the structure. Start by introducing yourself and setting the scene. Explain the reason for the consultation today. For example, you might start by saying something like, "I'm here today to talk to you about the results of the recent investigations you've had." Then you can explore what kind of symptoms they were having. Do they have any idea what might be causing the symptoms? And is there anything in particular that they're worried about? Now you can explain the results of the tests. I'd recommend breaking this down into small, digestible pieces of information. This really helps them process the information and also gives you time to think. Going back to the example of multiple sclerosis, you might want to start by saying something like, "The MRI scan shows that you have some changes in the brain. This is in keeping with a condition called multiple sclerosis. Have you ever heard of this?" Then explain the diagnosis in lay language. For example, multiple sclerosis is a condition in which your immune system mistakenly attacks the nerves in your brain and spinal cord. This can lead to some of the symptoms you've been experiencing. Before my exam, I read patient information leaflets on common conditions like brainstem death and multiple sclerosis. These were really helpful in learning how to phrase things in a lay language. Then you can discuss any treatment options and further investigations that might be required. This doesn't need to be in-depth, but the examiners will expect you to provide a brief overview. Going back to the example of MS, as this condition is incurable, it's important to highlight this to the patient and emphasize that any treatment options are aimed at reducing the risk of relapses and disease progression. In MS, treatments are usually initiated by a specialist, so you can mention that you'll arrange a follow-up appointment with the specialist. In the last part of the scenario, it's important to talk about the impact of the diagnosis on the day-to-day life. This might be on work, any high-risk activities, driving, and fertility. So in the case of MS, particularly if it's a young female, fertility is an important point to discuss. If relevant, you can also explore any risk factors they can modify to try and reduce the risk of disease progression. End the scenario by briefly summarising what you've discussed today and offering the opportunity to answer any questions. Remember to offer them a patient information leaflet and a follow-up appointment with the specialist. Thanks very much for watching this video, and I hope you found it useful. If you did enjoy the video, do hit the like and subscribe button to stay up to date with the latest content.